Okay. Assalamualaikum and good afternoon to Ms. Jamhira and fellow classmates. Okay, so today our group 2 will present um Agenda Nasional Malaysia Agenda Nasional Malaysia Sihat, or known as ANMS. It is under the health sector. So now I will show you that our team actually consists of 5 members. Um, including NURUL AINA binti ZULKEFLEE, FARAH FAIRUZ, INTAN SHAHARUDDIN, MOHAMED ZAMRI bin KADIR, ARIF, and ARIF MAHATHIR bin KAMARUDIN. So now I will explain to you our detailed overview of what we'll be discussing today. So this is our content. First, introduction, policy problems, objectives, strategies, strengths and weaknesses, recommendations, and we'll end our presentation with conclusion. Okay, so to start off, for introduction, Agenda Nasional Malaysia Sihat, or known as ANMS, was launched in August 7, 2020. It is an comprehensive public health strategy, which means that it is a holistic, multifaceted approach that were designed to improve the health and well-being of a population by addressing the full range of factors that influence health. So this is a 10-year implementation policy, and this ANMS will actually promotes health and well-being through a strategy called Whole of Nation. And this technique actually enables the participation of government agency, non-governmental agency, NGOs, private sector, and the general public, the people. So it is aimed to revolutionize public health through preventive measures and lifestyle improvements. Okay, for this, it doesn't mean not only the diseases, but also just overall health well-being of people. And this policy was actually led by the Cabinet Committee under the Prime Minister oversight with the Health Minister's strategic direction. It is monitored by the Health Minister because the Health Minister could make sure that the policy that were applied is successful and it will be giving a positive impact to the nations. As this agenda, like I said before, it is to aims to improve health outcomes, lower healthcare costs, and promote social well-being in our nations, as public health is a common responsibility among all nations. Now, I will pass to the next presenter, Mahathir, to introduce policy problem.
Thank you to Farah. We move to policy problem. The first one in policy problem is non-communicable disease, and also known as NCDs. Firstly, non-communicable diseases such as diabetes, hypertension, and cardiovascular disorders are on the rise in Malaysia. These are largely driven by lifestyle factors, including smoking, excessive alcohol use, poor diet, and physical inactivity. For instance, the National Health and Mobility Survey, and also known as NHMS, in 2019 revealed that 18.3% of the nation had diabetes, while nearly 30% had hypertension. This is particularly concerning as cardiovascular diseases are among the leading cause of deaths in Malaysia, with these life factors as major contributors. The second one is obesity. Related to this issue, which also contributes to various health problems, Malaysia has one of the highest rates of obesity in South Asia, with over half of adult population, which is 50.1%, being overweight or obese, according to NHMS 2019. This rise is linked to sedentary lifestyle, poor diets, and excessive sugar drink consumption. The next policy problem is lack of health awareness. Many Malaysians are not fully informed about the benefit of preventive healthcare and healthy lifestyle habits. This lack of awareness often delays diagnosis and treatment, increasing healthcare cause and worsening patient outcomes. For an instance, research from BMC Public Health highlights that many Malaysians are unaware of how lifestyle change can prevent chronic diseases. The fourth one is mental health issues. Mental health is also growing a concern in Malaysia. The NHMS 2019 found that nearly 29.2% of Malaysian adults reported mental health issues, such as anxiety and depression. And the last one of policy problem is healthcare system burden. The cumulative effect of this challenge place significant pressure on Malaysian healthcare system. Hospital and clinic are often overwhelmed by the damage for chronic diseases treatment, resulting in increased cost and longer wait times for patients. The Minister of Health has highlighted the rising cost of treating NCDs, further straining healthcare resources. We move to the next presenter.
Okay, so now we discussing about the objectives that were highlighted by ANMS policy. So there are 4 objectives. Okay, the first one is to promote the culture of healthy living to enhance the health and well-being. Number 2, provide environments that support health and well-being. Third, empower the public to manage their health. And lastly, to strengthen the collaboration among strategic partners to achieve health and well-being. So these were actually highlighted by NMS. So this is their goals to what they want to achieve by the end of the policy. Okay, so now I will move to the next presenter.
Okay, now I will be talking about the strategies by ANMS. So we actually have 4 core strategies that is related to the objective mentioned by the previous presenters. So the first core strategies is strengthen the promotion of healthy lifestyle through mass media activities and influential strategy partner as spokesperson. The activities that we have here is promoting healthy lifestyle practices by ministries, state governments, public agencies, private sectors, NGOs and community organizations on their respective media platform. It also could promote a healthy lifestyle culture such as aerobics, 10,000 step challenge, fun sport, health day celebration, sports day celebration, health screening, family day, and mental health programs. So the second one is improve health welfare services by establishing facilities like wellness hubs and wellness on wheels to provide accessible services that promote a healthy lifestyle and environmental sustainability for health and well-being. So for information, wellness hub is an infrastructure that provides health promotion services like one-stop community center to the local community as one of the strategies in encouraging the community to adopt a healthy lifestyle to achieve well-being, while Wellness on Wheels is a mobile health welfare service. The activities that we have here is collaborating with ministries, state governments, and community leaders to establish new wellness hubs, such as the collaboration with the Ministry of Finance to establish wellness hubs at urban transformation centers, or also known as UTC. And the second one is developing a wellness app for citizens to assess and improve their self-health management skill. And then we move to the third core strategies, which is empowering self-help control. By expanding community and health empowerment program with targeted intervention based on settings and group. The activities are engagement with ministries, state governments, and agencies to implement empowerment programs such as the collaboration with MSOSH, Malaysian Society for Occupational Safety and Health. And another one is capacity building for strategic partner as trainers in self-help control, covering aspects such as healthy living practices, environmental hygiene, vaccination uptake, and new norm culture and SOP compliance. And the last core strategy here is enhance the cleanliness of the environment by raising public awareness about maintaining a clean environment. The activities that we're doing here is promoting a throw trash into the bin campaign, implementing the work clean up the program, advocacy with relevant public and private agencies, NGOs, and volunteers for joint involvement in the activities, and implementing sanitation and disinfection guidelines for public facilities and premises in local authority areas. So we actually have much more activities than what I've mentioned, but I just tell the most important that related to the core strategies that we have. So I will be passing the presentation for the next presenter.
Okay, thank you, Intan. So for my part, I will discuss more on the policy evaluation. So after we evaluate the policy which ANMS, we have list 5 of strength and the weakness after the implementation of the policy. So the first strength of the policy is reduction in NCDs. So like what Mahathir just already explained just now, NCDs such as cardiovascular disease, diabetes, obesity, and many more. So NCDs in Malaysia are a significant concern because before the implementation of this policy, it's about 73% of death in 2020. So according to the NHMS 2019, 1 per 5 adults in Malaysia had diabetes and 1 per 3 of them suffered from hypertension. So, through a program under the ANMS policy like a COSPEN, the number of people undergoing health screening is higher. It also could helping with earlier detection of NCDs. Next, the second strength of this policy is improvement in physical activity levels. According to NHMS 2019, it was revealed that 50.1 age 18 and above were physically inactive. Through ANMS campaigns such as Malaysia Sihat, Sukan untuk Semua, and many more programs, could promote physical activities in communities and also in schools. By continuous monitoring of this policy, it could achieve improvement in physical activity participation. Next, the next strength is cost saving in healthcare. So ANMS is designed to reduce healthcare costs by promoting preventive health measures. So by preventing diseases such as NCD, it can lower the demand. It can lower the demand for expensive medical treatment and hospitalization. Also, by focusing on prevention through ANMS, financial strain for NCDs for treating NCDs disease will be reduced. So the fourth strength is community involvement and nationwide reach. So this policy promotes a community-based approach. It engages with local communities, workplace, schools, and also healthcare providers. This collaborative approach could be seen in programs like COSPEN or Community Sihat Pembina Negara. So this program has successfully engaged thousands of local volunteers to promote health screening and disease prevention. So according to MOH annual report, this program has reached more than 1.6 million people. Hence, it can further enhance participation in healthy lifestyle initiative. And the last strength that we list under this after the implementation of this policy is reduction in smoking, alcohol, and in smoking and alcohol consumption. So the policy target on reducing the smoking and excessive alcohol consumption. By reducing these behaviors, it can directly impact the public health by lowering the rates of lung cancer, heart disease, and also liver damage. So, NHMS 2023 reported a decline in smoking prevalence from 23% in 2015 to 19% in 2023. So it shows the effectiveness of public health campaigns such as smoking bans in public area, and also increase in taxation on tobacco products. Next, I will discuss on the weakness of this policy. So the first weakness is implementation challenges. ANMS focusing on how to encourage Malaysians to adopt healthier lifestyles, including better eating habits and also more physical activity. However, lifestyle habits are cultural preference, and it can be difficult to change, especially in a short time. For example, there has been minimal change in obesity rates based on preliminary reports after the implementation of ANMS, especially in rural areas where health literacy remains low. Next, the weakness of this policy is limited funding allocation. So funds is crucial for successful implementation of any national health initiative. So a lack of sufficient resources can hinder the reach, effectiveness, and also on sustainability of the programs. The community-based programs such as a COSPEN could promote health screening and preventive health measures. By limited funding, it can restrict the ability to scale the programs to all regions, especially in rural areas. The third weakness that we could find is public awareness and behavior. The public engagement with policy has been inconsistent, and Malaysians still not fully aware of the programs available under ANMS. Some also lack understanding about the preventive health practice, like regular medical checkups, a balanced diet, and also regarding exercise. Next, the fourth weakness of this policy is insufficient focus on mental health. ANMS emphasizes physical health, and it does not place enough emphasis on mental health, which resulted in is increasingly critical issue in Malaysia. According to NHMS 2023, it has reported that the number of people suffered from depression doubled from 2019 to 2023. Also, Malaysia lacks manpower when it's related to mental health service. And the last weakness of this policy is urban-rural disparities. Unequal access to healthcare service and health education across urban and rural areas could found and after the implementation of this policy. Rural often face challenges in access the health program under this policy, and this is because of lack of infrastructure, resources, and also awareness. So through programs like COSPEN, rural communities still struggle with limited access. Hence, their participation in prevent health initiative remains low. So, as a result, health indicators such as obesity, it remain higher in rural areas more than in urban centers. So that's all for policy evaluation. I pass the presentation to the next presenter.
Thank you, Aina, for the explanation. So now we move on to the recommendation part. In order to implement this policy, there's a few challenges or weakness faced by the government, as what Aina has said just now. So, however, there's a few recommendations to overcome these challenges or weakness. For the first one is implementation challenges. So the recommendation is monitoring and evaluation To overcome these challenges, the government should develop a comprehensive monitoring and evaluation framework that can track the progress of lifestyle changes and address a rising issue promptly. This framework also to ensure that the program like Flip Malaysia and other health initiatives adapt to public needs. The framework should also account for regional differences, providing targeted intervention for rural population who may require more accessible and culturally appropriate health messaging. For the second one is limited funding allocation. So the recommendation is efficient resource utilization. To address funding limitation, it is essential to optimize resource utilization by prioritizing the most critical health intervention and ensuring efficient management of existing fund. Other than that, decentralizing health financing by giving more autonomy to local health authorities could also ensure that resources are better utilized to meet community needs. Additionally, reallocating funds from non-critical sector based on performance evaluation can help ensure that health agenda receive sustained and adequate financing. Number 3 is public awareness and behavior. The recommendation for this witness is multi-platform awareness campaign. The government can design and implement multi-platform awareness campaign that use a various form of media, including social media, radio and TV, to target different demographic effectively. Localized content should be produced in regional languages to make health information accessible to all citizens, including those in rural areas and indigenous communities. Influencer and community also can play a key role in spreading awareness at the grassroots level. Number 4 is insufficient focus on mental health. Recommendation for this witness is the ANMS should expand mental health services by allocating more resources to mental health infrastructure and increasing the number of trained professionals. This could involve scholarship and initiative for students who specialize in mental field like psychiatrists, clinical psychologists, and also counseling. And the policy also should encourage the establishment of community-based mental health center, especially in underserved rural areas, to ensure the accessibility. The last one is urban-rural disparities. So the recommendation for this witness is equitable resource distribution. To bridge the gap between urban and rural healthcare access, the government should implement equitable resource distribution strategy, ensuring that healthcare facilities, resources, and health education initiative reach underserved rural areas. Mobile health clinics such as Wellness on Wheels (WOW) initiative should be expanded and optimized to serve remote community. The government could establish telemedicine network to provide virtual consultation to rural population. Is to allow patients to receive care from specialists without need to travel. So that is from me for my part, and I pass to Farah for the conclusion of the presentation.
Okay, so now we have reached the last part of our discussion. So what we can conclude based on our discussion is that this policy can be continued. However, there's some changes that need to be made because it is based on strength and weaknesses. So as you can see, one of the weaknesses that we can take from INA's part is that there's no public awareness. So that is the main point of the reason why this needs to be changed. And then we do have a list of references that we are referring to during our research, and that's all from us. Thank you.